Arizona. We have been the opioid dependency, and many start with some sort of injury or pain problem, and now there's a push to help people manage pain more naturally. So we have Dr. David with us from Paragon Chiropractic, and he has some ideas on how we can handle pain without going to those drugs right away. Dr. Dave, thank you so much for being here. Appreciate you.
Yeah, thank you.
Tell me a little bit about what people are coming to you for.
Well, basically chronic pain. So anytime you have pain that simply won't go away, it should be better by now. It just hasn't gone away. What you're looking at is an unresolved inflammatory process. So if you think about a fire, a small smoldering area, say in an elbow, a shoulder or a knee or a hip or something like that, and the inflammation just continues to destroy the joint, and it repairs itself with scar tissue, limits the motion, the scar tissue breaks down, so it's a smoldering fire. So what we need to try and do is try to resolve that inflammatory process.
And you have a new machine here that you're using that you really like. Tell me what this thing is called and how it works.
All right, this machine is called a MyACT machine, and it's MyACT. So My is for myofascial, which is muscle tissue and tendons and ligaments and things. And it's acoustic, so it's an ultrasound machine. So we use a compressive force, and it irritates the tissue. And in irritating the tissue, it signals your body to start a new healing response where it says it's already healed.
And have you been seeing a lot of good results?
Yeah, tremendously. Recently what we've been doing is we've been seeing a lot of post-surgical cases. So here it is 6 months, 9 months later, knee replacement, hip replacement. The person should simply be better by now, and they can't walk and it hurts. We can use this over metal joints and everything along those lines, and it actually sets up a new healing response and puts the fire out. And so it feels better.
All right. Well, let's fire up this machine here because I said I'm having some aches and pains. My texting arm is funny. So we're going to work on like my elbow area.
Yeah.
And what do we do? How do we start?
So what we do is I'll come over here and we put ultrasound on the head.
Okay. And how long does the process take?
It's about 20 minutes.
Okay. So we'll just do
We're not going to
We'll do 30 seconds.
So then what I do is I hit the button here.
Wait, what's it going to feel like? It's clicking.
You won't feel anything till we find an area, and it'll feel like a toothache. You feel that kind of a weird sort of a sensation. So it's an ultrasound, and it just, what we're doing right now is we're irritating the tissue, and we're inviting your immune system to come back and take another look at this.
We invite you back, immune system.
Yeah, that's correct.
Our SVP, please.
Yeah.
Nice. So it does. I can feel something happening, but it's not painful at all, or even a sting or anything like that.
No, we'll find an area,
and it'll, right there. Is that it?
It'll feel like a toothache. So I'll camp out on this area until you say it's gone away.
No. Okay.
So
I was going to say, just leave it here. That feels good. Yeah.
The thing that's nice about this is it's patient directed or guided. So you tell me where the sore spots are.
Yeah. Well, I could tell you're in the hot spot right there. So the process, we're sitting there for about 20 minutes. That's how we're working.
That's correct.
Do we work on one specific area at a time, or if I've got, something going down with my knee now, we move to the knee
We could go to the knee.
Okay.
Yeah. The thing is, we can only do this about every 4 days because we're initiating a new healing response. So we can't do this every day.
So I'm going to be brand new by tomorrow, I think. Awesome. Dr. Dave, you're the best. Paragon Chiropractic, thank you so much. What is this machine called again?
It's called MyACT.
MyACT.
It's an acronym for myofascial acoustic compressive therapy.
I'll remember all of that. Thank you, Doc.
Okay, thank you very much.
Up next in news, some people may have found their vacations a little delayed after airports had to close for a while due to this right here.